Hi, and welcome back here on the Senior Network. We are now joined by Tatiana Zanzig, Pruitt Home Health. How are you, Tatiana?
I'm great. How are you?
Good to see you. Well, right before the show, you'd brought up a good point I'd forgotten about. November it's American Diabetes Month, correct?
Yes.
Well, tell me how that affects Pruitt Home Health.
Well, as you might already know, first of all, diabetes is extremely common. It's growing more and more common, which is unfortunate.
Yeah.
And we get tons of, new patients who are newly diagnosed and in need of education. Diabetes really puts individuals at risk for other issues, heart disease, delayed healing, delayed wound healing, adverse outcomes from COVID, increased risk of stroke. So really, in addition to just managing the diabetes, it really helps promote positive patient outcomes when we can help somebody better manage their diabetes. So in terms of home health, we really try to focus on education. We try to focus on making sure patients understand where their blood sugars need to be, ways to avoid, elevated blood glucose levels, which can damage their, blood vessels and their nerves, and then ways to avoid any side effects from the medication they're taking. So there's a lot that goes into it, and home health, especially Pruitt, we really like to be a resource to our patients and families dealing with diabetes.
Right, exactly. Well, I know you are, and I know your clinical staff, I'm assuming, like you said, you guys have a lot of education for your nurses and so forth that are going into the home, so they can do counseling, correct?
Oh, absolutely. Absolutely. And it can be really overwhelming, a new diagnosis of diabetes. So we really try to, do everything we can, give our patients and families the tools they need to really drive down those blood glucose levels.
Correct. And for the viewers that may not know, I know that the community, you're very personally very well known in the community, and you're a person of resources, meaning if someone's in the hospital, they're coming out, they actually can set up a time and speak with you by phone, correct?
Oh, absolutely. Anyone is welcome to give me a call at any time, and I always let my patients and families know that. I give them my work cell. They can call or text me anytime. And then even people who are not active patients of ours, they can always reach out to our office and get in touch with me. We're happy to answer any questions, regardless of whether or not somebody is, active with our agency.
Exactly. And so, Tatiana, I know you're kind of the first face and voice, maybe, if you will, for Pruitt. And then after that, kind of explain to us a little bit about how does it take place after that as far as starting care?
Sure. So a lot of the times we get individuals referred to our agency, once they're in a facility. Sometimes we get provider offices reaching out to us as well if they have a patient who is either in need of additional education or struggling with medication changes related to their diabetes, or if they do have new onset and really need the education. A provider, either at the hospital or in the office setting, will typically reach out to us, usually by fax or email. They'll send us a little referral form that'll kind of instruct us on what an individual's diagnoses are, and what disciplines might be needed. And when I say discipline, I mean, skilled nursing, physical therapy, occupational therapy, different things that we can address. So usually the first step is an order from a doctor.
Okay.
But I try not to let families or patients get discouraged. If somebody just wants to reach out to us, which we get, inquiries all the time, I can do the legwork as far as reaching out to the doctor's office and getting the paperwork I need. I wouldn't want the family to have that burden. I could help with that.
Understand. Tatiana, always great information. I sure appreciate it. Thank you so much.
Thank you.
Stay with us. More to come here on the Senior Network.